Welcome to our NCLEX review. We're covering the top 20 NCLEX questions that nursing students need to master. Feel free to pause and think through your answer before we reveal the correct choice and explanation. Let's get started. Question 1, prioritization. You have 3 patients. Patient A, post-op BP 110/70, alert. Patient B, asthmatic wheezing RR28, and patient C, diabetic, blood sugar 150. Who do you see first? A, patient A, B, patient B, C, patient C, D. None of the above, answer B. Prioritize the most unstable patient first. ABCs, airway, breathing, circulation. Question 2, ABCs. A patient is choking and confused. What is your first action? A, start CPR. B, check airway. C, call family. D, give fluids. B, check airway. Secure the airway first. Question 3, safety, falls. Which patient is at the highest fall risk? A, elderly patient on bed rest. B, patient walking independently with a cane. C, post-op patient fully ambulatory. D, teen patient with no history of falls. A, elderly patient on bed rest, age and mobility limitations equals high fall risk. Question 4, medication administration. You're giving Digoxin. What must you check first? A, apical pulse. B, BPC, temperature. D, respiratory rate. A, apical pulse Digoxin can slow heart rate. Check apical pulse before administering. Question 5, lab values patient's potassium equals 2.8 MEq/cell. What do you do first? A, encourage bananas. B, call the provider. C, document and continue. D, assess for bleeding. B, call the provider. Hypokalemia can cause arrhythmias. Notify the provider for intervention. Question 6, delegation. Who can give oral medications? A, RNB, LPNC, UAP, D. All of the above, A and B, RN and LPN, not UAP. No scope of practice. UAPs cannot administer medications. Question 7, infection control patient has MRSA in the wound. What precautions are required? A, standard precautions. B, contact precautions. C, airborne precautions. D, droplet precautions. B, contact precautions. MRSA spreads via contact. Use gloves, gown, and dedicated equipment. Question 8, pediatric development milestones. At 6 months, a baby should be able to A, crawl. B, roll over. C, sit independently. D, walk. B, roll over. Developmental milestones are frequently tested. Question 9, fluid and electrolyte imbalances. Patient has hyponatremia, Na plus 125. First action, A, administer IV fluids immediately. B, assess neurological status. C, encourage water intake. D, give diuretics. B, assess neurological status. Low sodium can cause seizures and confusion. Question 10, cardiac emergencies. A patient is experiencing chest pain with ST elevation on the ECG. What is the first action? A, administer aspirin. B, call the provider. C, start CPR. D, monitor vitals. B, call the provider. ST elevation indicates potential MI. Notify provider for timely intervention. Question 11, respiratory issues. A patient with COPD has an oxygen saturation of 88%. What is the first action? A, raise the head of the bed. B, call a code blue. C, administer IV fluids. D, give a bronchodilator without assessing. A, raise the head of the bed, improve oxygenation. Question 12, diabetic emergencies. A patient's blood glucose level is 45 mg/dL and they are confused. What is the appropriate action? A, give insulin. B, give fast-acting glucose. C, call the provider. D, give water. B, give fast-acting glucose. Hypoglycemia is life-threatening. Treat immediately. Question 13. A patient is experiencing chest pain. Which medication is often administered first? A. Aspirin. B. Nitroglycerin. C. Morphine. D. Atropine. A. Aspirin. Aspirin is often given immediately in cases of suspected myocardial infarction, heart attack, to help reduce clotting and minimize cardiac damage. Question 14. A patient has diabetes and is prescribed insulin. What is the primary action of insulin? A. Increase blood glucose levels. B. Decrease blood glucose levels. C. Increase blood pressure. D. Decrease blood pressure. B. Decrease blood glucose levels. Insulin helps cells absorb glucose from the bloodstream, lowering blood sugar levels. Question 15. A patient is prescribed furosemide, Lasix. What is the primary effect of this medication? A. Increase blood pressure. B. Decrease blood pressure. C. Reduce fluid volume. D. Increase heart rate. C. Reduce fluid volume. Furosemide is a loop diuretic that helps remove excess fluid from the body by increasing urine production. Question 16. A patient is experiencing a thyroid storm. What medication is commonly used to treat this condition? A. Levothyroxine. B. Propylthiouracil, PTU. C. Metoprolol. D. Potassium iodide. B. Propylthiouracil, PTU. PTU helps reduce thyroid hormone production. Question 17. A patient is prescribed atorvastatin Lipitor. What is the primary purpose of this medication? A. Lower blood pressure. B. Reduce cholesterol levels. C. Prevent blood clots. D. Increase HDL levels. B. Reduce cholesterol levels. Atorvastatin is a statin that helps lower LDL, bad cholesterol. Question 18. A patient has a potassium level of 6.5 mqol. What is the nurse's priority action? A. Administer potassium supplements. E. Restrict fluid intake. C. Prepare for cardiac monitoring. D. Administer insulin. Prepare for cardiac monitoring. Hyperkalemia can cause cardiac arrhythmias. Question 19. A patient is prescribed heparin. What is the primary action of this medication? A. Dissolve blood clots. B. Prevent blood clots. C. Increase blood pressure. D. Decrease heart rate. B. Prevent blood clots. Heparin is an anticoagulant that helps prevent new clot formation. Question 20. A patient is experiencing status epilepticus. What medication is often administered first? A. Lorazepam, Ativan. B. Phenytoin, Dilantin. C. Valproate, Depakote. D. Carbamazepine, Tegretol. A. Lorazepam, Ativan. Lorazepam is a benzodiazepine that rapidly stops seizures. 20 essential NCLEX questions. Remember to focus on prioritization, safety, and the nursing process. Keep practicing and you'll be ready for exam success. Good luck with your NCLEX preparation. If you found this video, like, subscribe, and share.